The current pandemic was arguably characterized by information overload. For public health, we need to know how this affects different people in society, and here we ask if relevant information reached migrants. We find that in general, yes, this is the case, but socioeconomic vulnerability is associated with lower levels of COVID-19 related health literacy among migrants. I am Didier Ruda, University of Neuchâtel, and this is joint work with my colleagues listed on the screen. The study was commissioned by the Swiss Federal Office for Public Health. In this study, we use a survey and target potentially vulnerable migrants. For the survey sample, we targeted foreign nationalities that we know from other studies to have many individuals in precarious situations, have low levels of education, etc. So here nationality acts as a proxy. We use a representative sample from registered data and complemented this with a targeted sample using NGO and other intermediaries to make sure that we also reach the most vulnerable among the migrants. We offered shopping vouchers to the NGO sample. Both approaches worked well, and overall the sample is some 2,300 respondents. The field work took place in November 2020 in the midst of the second wave in Switzerland. We used a multidimensional measure of health literacy, finding, understanding, evaluating and acting on COVID-19 related health information. Each aspect is captured with multiple questions. We translated the questionnaire from another study that studied the general population into 8 languages. The reference is on the screen. And we added factual knowledge questions as well. This all is combined in an index of health literacy. We then measured socioeconomic vulnerability with an index based on language skills, education, employment status, income and residence status. Even though we focused on nationalities with many vulnerable migrants, on average, health literacy was similar to the general population. We know this because we have the same questions as the study on the general population mentioned. But in all dimensions of health literacy, that is finding, understanding, evaluating and acting on, more vulnerable migrants report worse outcomes. We find this for finding information. To illustrate this, here is a single question on finding how at risk one is personally. Look at how the red and orange bars indicating this to be difficult or longer for the vulnerable migrants, that's the top bar. From the other questions, we know that relevant information came mostly from a mix of country of origin in Switzerland or only from Switzerland. We also find that the most vulnerable people on the index consulted fewer sources and trust these sources less. The same pattern can be found for understanding information. Here, official hygiene instructions on the top right, evaluating information and acting on information at the bottom of the figure. In all cases, more vulnerable migrants, that is the top bar of the two, report lower health literacy, that is a shorter blue and longer orange and red bars. We also included factual questions, and once again the more vulnerable among the migrants are more likely to get these wrong. To illustrate this, here's the mistaken belief that COVID-19 is transmitted by mosquitoes. The share of wrong answers, the red bars on the right, is higher for more vulnerable migrants. At the bottom you can see how these findings are robust when we apply multiple regression analysis. We can see substantially less health literacy, our outcome variable, for lower levels of socio-economic vulnerability. That's the first point very far on the left. Not all migrants have poor health literacy, but there are socioeconomically vulnerable migrants with lower health literacy, as we demonstrated. Note how averages, if you only compared natives and migrants for example, can have problems with health literacy, and how being a migrant as such is probably not the relevant perspective to see differences in health literacy. We note that migrant media, cultural and religious organizations are trusted intermediaries for vulnerable migrants. So to conclude, it is not enough to translate public health messages, but we also need to actively disseminate these to make sure vulnerable people are reached. A research report is available in French. Thank you.